All right. So, infectious causes, disorders. So, the cold. So, when you think of a cold, runny, stuffy nose, remember this is a respiratory system, extremely contagious, spreads quickly, especially with I blow my nose and I touch everything and I don't use hand sanitizer or wash my hands. I sneeze all over a table. It's important that you don't get other people sick because you're not cleaning up after yourself. Next couple ones are pretty easy. Pharyngitis. Your throat is red and inflamed. That's it. Okay, it could be caused by a whole bunch of drainage. It could be caused by a bacterial or viral infection. So, strep throat could be a possibility. But pharyngitis is just saying your throat's red and it hurts. That's it. Laryngitis. This is usually when you lose your voice. Again, a lot of times it's because of drainage. Your nose is draining and draining and draining, and your throat is red, you're raw, and your voice box gets red and raw. And so people become hoarse, they lose their voice, and it's often secondary to respiratory infections. So we've got something else going on most of the time. Sinusitis. Sinuses, inflammation. What does that mean? I got a sinus infection. That's all that is saying. A lot of times with the sinus infections, you're going to see the pressure right above your teeth, beside your nostrils. That's where the maxillary sinuses are. Puts pressure on your nerves for your teeth, and you'll see teeth pain. So other sinuses get blocked, can cause ear pain, tightness in the face, your face hurts, trouble getting the snot out. With a sinus infection, you will see yellow-green snot. That's one of the symptoms that you will see. But facial pressure, teeth pain, ear pain, face pain, head pain, sinus headaches are really common. Bronchitis. Again, my bronchial tubes or bronchi are going to be red and inflamed. Now, if you are a smoker, you are most likely, you are at a higher risk of getting bronchitis continuously, several times a year, year after year after year after year. Why? Because your lungs are damaged because of the smoke. And so it's very easy for them to get irritated. So with bronchitis, you're going to see a lot of mucus, a lot of coughing. You're coughing stuff up. A fever, you're going to raspy sounds. Influenza or the flu. The flu is a respiratory. A lot of people will say, well, I had the flu and I had diarrhea and vomiting. That would be a stomach virus or a bacterial infection or something with the stomach or intestines. The flu, influenza, is going to be a respiratory system problem. And some big things with the flu, it can cause death, pneumonia, bronchitis, some serious complications with it. Flu shots are important for the elderly, the young, and sometimes, like as a parent, you get the flu shot to help protect your kids. Because if you get it and you give it to the kids, they're going to be at a higher risk of having serious problems. The elderly and the young are more likely to die of the flu or anyone else with major health concerns. Remember that there's going to be several types of flu throughout the season. The flu shot is only going to cover one of those types. Pneumonia. Okay, pneumon is lung. With pneumonia, you're going to see, you could see fluid is going to build up. Okay, and that fluid fills up the alveoli, so essentially you're drowning, and that oxygen and carbon dioxide cannot be exchanged if there's too much fluid in there. A lot of chest pain, a lot of coughing, fever, chills, trouble breathing. Diphtheria, it's not as common anymore, but kids do still receive the vaccine for it to help protect against them. So that is another lung problem. Pertussis, again, a vaccine for pertussis. Before I forget, pneumonia, there is a vaccine for elderly people, 60 or 65 and above. They recommend that you get a vaccine for the pneumonia. Back to this, pertussis or whooping cough. Coughing attacks sounds like a seal barking or a whooping sound. There is a vaccine for it. People with asthma are more likely at a higher risk with this. Um, Definitely a lot of coughing. It's chest hurting kind of coughing, and it spreads pretty easily. So it's important that you get the vaccine for it. And if your child has whooping cough or pertussis, that they stay home. TB, tuberculosis, health career kids, you got your TB test. TB is an infection of the lungs. You can have it and not know you have it. Um, it just stays dormant. It can cause lesions on the lungs. Those are your tubercles. You got to get exposed to it. Gentleman with TB got on the plane, this year, last year, something like that, caused a big controversy because he could have spread it. Couple different types of TB. Um, you can do some tests to see if you have it. The biggest one is they inject some stuff under your skin, and then 2 days later they read it to see if you reacted to it. People with AIDS, TB is pretty serious with that. See it with illegal immigrants, people in poor housing, people of poor health. Anthrax. Anthrax is something that hasn't been around for a little while. September 11th, there were some anthrax scares. Anthrax is spores. So when I say spores, what I want you to think of is when you look into the light, you can see like these little dust particles in the air. That's what you need to think of. That's this small. Um, Invisible normally, odorless, colorless, tasteless, unless you've got a large amount of it. Um, so what people were doing with this is they were putting anthrax in envelopes and sending it to the president or to other major people trying to kill them. If you would put spores in a ventilation system, it could kill potentially anybody that came in contact with it. A couple different types or forms of anthrax. So it's pretty serious and it's pretty hard to come by. It is treatable with antibiotics. It should not be contagious, but it's not something that is too big of a concern that we need to vaccinate everybody. Rhinitis. Rhinitis says that my nose, rhine, is inflamed. What does that mean? That means I got a runny, stuffy nose. Essentially, that's it. It could be because of allergies, or it could be because I got a cold. Not too worried about these other two. You can read those. Asthma. Big thing with asthma is remember that we can't, once we're on the inside of the body, we can't swell out. So with asthma, they're swelling in. So remember I said that your bronchial tubes and your bronchi are tubes. If I have an asthma attack, the swelling goes inside. So my tube gets smaller and smaller and smaller and smaller. It'd be like they compare it to breathing through a straw. 5% of the population have asthma. You usually treat it with aerosols, with inhaler. Important that people with asthma don't smoke, aren't exposed to smoke all of the time. That can cause damage. Asbestos. Asbestos is something that is still around in old houses. It was used in insulation, and with that, um, it if it's breathed in, those little fibers will cut into the lungs and cause damage and scarring. So it will cause damage to the lungs and you won't be able to breathe. A lot of people with asbestos that worked with asbestos filed suits and sued and got a whole bunch of money because essentially the inside of their lungs are damaged and they're going to die from this. And once we figured that out, then that's something that we right away took out. They do check old houses, the insulation for asbestos, and once that inside of the lungs gets scar tissue, it's going to have a lot of trouble expanding, contracting, and there's going to be no cure for that. Silicosis, that's another one that you're going to be breathing in. You're going to see this with minors. So this Kentucky, West Virginia, those are going to be places where you're going to see that. Nasal polyps are going to be polyps, or a polyp is something that grows there that's not supposed to. So if I have something growing inside of my nose that shouldn't be there, it's going to cause an obstruction in my airway, and I'm going to have trouble breathing. COPD, chronic obstructive pulmonary disease. What does that mean? That means that you can't breathe. Most patients with COPD were exposed to something or they are smokers. So they have some serious lung damage and they can't breathe. With emphysema, what you see is that the alveoli are so damaged, they lose their elasticity. What does that mean? It means that they can't stretch. They will rupture and collapse. So what I'm doing is I'm knocking all of those little buds are collapsing, and it gives me less and less space to exchange oxygen and carbon dioxide. Essentially, these people are suffocating very slowly to death, and it will keep going until it kills them. Lung cancer causes a whole lot of deaths. Survival rate, once diagnosed, 15% make it 5 years. I hear all of the time, so and so got diagnosed with lung cancer and died 2 weeks later, 2 months later. To make it past the first year after diagnosis with lung cancer, most people don't. Most patients with lung cancer are smokers. If they aren't smokers, they were exposed to smoke, like with their parents, a waitress in a restaurant, those types of things. And that is one of the biggest reasons that they went to there is no smoking in the public places, is because if you do that, then your smoke can cause damage to somebody else. Important thing to remember is you've got secondary smoke, and that's you breathing in somebody else's smoke, but you've got third, um, and that would be like you hear parents say, well, I smoke outside and then I come in. The problem with that is the smoke is on in your mouth. You breathe out, you can smell that somebody's just had a cigarette. On their clothes, you can smell that somebody's just had a cigarette. And if I were to pick up a baby or a young child, they are breathing that in, and that is actually causing damage also. So that's secondary is breathing in the actual smoke. This is third then. And you're breathing in the stuff that's on their clothes, on their breath, and all of that stuff. That actually causes damage too. So that statement of I breathe outside, I smoke outside, that doesn't work. And oh, I smoke in the car, but the window's down. That doesn't work. Okay, so that's not an excuse. Your kids are still getting all of that smoke and all of that stuff that comes from that. Lung cancer is pretty nasty, and it goes very, very fast. Cancer in the larynx, you see that a lot in men. That would be I would have to take the larynx out, and you would put that little vibrating machine up to their throat, and then they are able to talk. Pulmonary embolism, we talked about that. And then, whoops, the last one is SIDS. SIDS is sudden infant death syndrome. A baby is going to die somewhere between 2 weeks to 1 year, and the baby just stops breathing during their sleep. There is no way to tell if a child's going to die of SIDS. Some things to help stop a child from dying of SIDS. Number one is if they have a binky or they suck their thumb. That is one way to actually help prevent SIDS. Put the child to sleep on their back. Don't overheat them. Their body temperature needs to be normal. For a mattress, no blankets, no bedding, no pillows, no stuffed toys. So SIDS just means all of a sudden the child stopped breathing in their sleep. There's no warning signs. The baby's perfectly healthy. There's nothing wrong with them. Their brain just stopped telling them to breathe. Okay, that's it.